Hello everyone, I'm Dr. Naveen from UPSC Medico. In this video, I'll be discussing 2021 paper of the recent UPSC Medical Science Optional 1. We also have 2020 paper discussion in our YouTube channel, but this is made into 4 parts. Paper 1, section A, B, and we also have paper 2, section A, B. Each video amounts to some 30 minutes or odd. This time what I'm doing is I'm doing the whole paper in a single video, and I want to go very fast because at the end of the day the purpose is for 2022-23 upcoming batch. I think analyzing previous year papers is a golden duck for you, right? Not only for medical science optional, any UPSC exam. The preparation should be syllabus centric and in a previous year question fashion, because many are repeats. When I say repeats, the amount of repeats are very high with medical science as an optional. Okay, so you will understand this by the end. So it is very important video for a serious aspirant, so do watch it till the end. Now we're starting with paper 1 section A analysis. Question 1, the sub part of the question 1 is on coronary sinus. From anatomy we have, so in the syllabus, blood supply of heart is given in the syllabus. Okay, blood supply of heart. So blood supply of heart is indirectly the coronary circulation, but many of the times from 1997, 2006, 2016 and 2018, when I say blood supply, when I say circulation, we always think of arterial supply, right? So in the arterial supply of the coronary circulation, we have left coronary artery, right coronary artery, coronary dominance. So the questions are on coronary circulation of heart, applied anatomy, blood supply of heart, applied anatomy, diagram to depict the blood flow in left versus right coronary artery, and describe coronary arteries, add a note on cardiac dominance. Now they went to such an extent that they are also asking the venous supply, because it's very important when in the exam when they ask you blood supply, even in during test series correction and evaluation, I have found out that if I ask you question on blood supply of thyroid, many of the students or aspirants are giving answer on only the arterial supply of thyroid. It is very important that blood supply is both arterial and venous, and this fact is the major force behind this question. So here in the coronary circulation itself, they are asking you what is coronary sinus, that is the venous supply of the heart, venous supply of the heart. They're asking you formation, course, tributaries and termination. I think each carries 2.5 marks here. So this is within the syllabus, and the question is from anatomy, that to blood supply of heart, and there are almost 4 repeats in the recent past. Okay, now in the question 1, the subpart question 1b is role of cerebellum in maintenance of posture and equilibrium. Like starting from 2006 onwards, 2009, 2016, 17, 18, 19, almost for the 4 consecutive years, there has never been paper without a question from control of posture or equilibrium. Even in the 2020 paper also there is a question on posture and equilibrium. So control of posture and equilibrium is in the syllabus, and the question is about what is the role of cerebellum or the functions of the cerebellum. What is the archeo, paleo and neocerebellum and all, and there are so many questions on the cerebellum, like functions of spinocerebellum, structure, add a note on what is cerebral peduncle menopause. So cerebellum per se is very important topic, both from neuroanatomy aspect and also very importantly from the physiological aspect, from maintenance of posture and equilibrium. Cerebellum, basal ganglia and cortex, cerebral cortex, they all take part in maintenance of the posture and equilibrium. Here they are specifically asking what is the role of cerebellum in maintenance of posture and equilibrium. The next question 1c is, a 14-year-old girl presented with low-grade fever, loss of appetite, yellow, this is actually discoloration of conjunctiva. So yellow discoloration of conjunctiva is jaundice, and if you don't know answer for this question, you are not ready for this particular exam, let me tell you, because every year there is a question on jaundice from biochemistry, from biochemistry, that too which aspect of biochemistry? From the organ function test. From the organ function test, we have three important organs, like one is thyroid, the other is kidney, and the most important one is liver. And from the liver, enzymatic assay, evaluation of the jaundice, differentiation of pre-hepatic, hepatic and post-hepatic jaundice has always been examiner's favorite topic, right? So the jaundice, from the biochemistry point of view, they're just asking you, see, again, though the question looks clinical, it's only to kind of give you some temper tantrums, but at the end of the day, just look at the subparts. Define and classify jaundice. Okay, yellow is discoloration of the skin and conjunctiva is known as jaundice. And how do you classify jaundice? It can be pre-hepatic, hepatic and post-hepatic. Describe the laboratory test for jaundice and the clinical interpretation. So draw a table, pre-hepatic, hepatic and post-hepatic. What are all the lab changes which occur? Okay, so we have discussed it very well in the biochemistry classes, lectures, test series, grand test. It's there everywhere, the question on this. So why it is important? You see, look at this 2020, most recent question. A 15-year-old slum boy presented with fever, vomiting and yellowish discoloration. Now, instead of asking you what are the biochemical abnormalities, they have given you a biochemical abnormalities, and now they are asking you to find out whether it is pre-hepatic, hepatic or post-hepatic or obstructive jaundice, and also classify based on ethiopathology and write their main biochemical. Same question in a different format. Now don't say that paper is too clinical, paper is too clinical. See, what is the reason behind giving some clinical question is at least to make sure that you understand the applied or clinical aspects of the particular topic which you are reading. Unless and until you know that, you're not ready for either exam or you're not ready as a doctor, right? So even though the answer looks simple, you have to interpret the question here. The same question in 2019, see, total bilirubin direct, they have given a 35-year-old man presented with complaints of weakness, loss of appetite, yellowish discoloration. LFT was done, and what is the most likely diagnosis and what are the expected findings in urine and stool. See, simple laboratory test. Instead of that, they have dissected it and given it. Not only that, in 2017, 2005, 2011, 2014, everywhere, from the biochemistry organ function test, the jaundice part is very important. So that's the reason I told you, you're not ready for this exam unless and until you are up for this question. So these are golden questions for you. Now, this is kind of like out of the box question. In the whole paper, in the whole 2021 paper, only one question is unpredictable. That is this question. Describe the typical intercostal space. Now, when you look at the anatomy syllabus point of view, okay, anatomy syllabus point of view, nothing is mentioned about thorax. Okay, nothing is mentioned about thorax. So thorax is not in the syllabus per se. Only upper limb, lower limb were there, joints were there, and also abdominal organs are there. But one aspect is there, that is they are just applied anatomy of diaphragm. So again, there is a confusion. Is it pelvic diaphragm or is it abdominothoracic diaphragm? But when I say diaphragm, I think it is very commonly we take it as abdominothoracic diaphragm, because there are previously some questions on diaphragm, congenital anomalies and all. Now, thorax is not in the syllabus, but even in 2019, 2020 also, and once in somewhere around 2014, they asked a question on bronchopulmonary segments of lung. Okay, bronchopulmonary segments of lung, and now they're asking you describe typical intercostal space, right? So please ignore this question per se, because you're not going to learn the whole thorax for 5 to 10 marks, because which is not given in the syllabus, and very rarely, only 3 times questions were asked from thorax. But if you are starting in 3rd year of your preparation, and if you also want to be prepared for rare things, which I don't prefer or which I don't encourage, rare is always a rare. You have to be ready with the common stuff. Let me tell you, this is the only 10 mark question, which is, I personally feel that it is out of the syllabus. But again, if you attend my classes, if you attend the test series, in the test series there is a question on pleural tap. How do you perform this pleural tap? And in that we clearly discussed the intercostal structure and where to insert the needle. Is it superior border or inferior border? Because based on that, we during the pleural tap, we avoid superior border or inferior border. We make sure that we do not injure neurovascular bundle, and also basic knowledge is we have external intercostal muscles and internal intercostal muscles. And again, during coarctation of aorta, X-ray findings, I told you, notching of the superior ribs is characteristic of coarctation of aorta. You can link all these things and present it in a clinical aspect, right? Because from anatomy, whatever is the question they're asking, whether it's a gross anatomy or a microscopic anatomy or relations of the anatomy or movements and all, at the end of the day, you have to give them the clinical aspect or applied aspects of the anatomy. So that way, I think you are ready for at least 4 to 5 marks here. But I don't encourage you to read the whole of the thorax, which is not in the syllabus. If you want to do it, it's up to you. But what is dictum in medicine? Be prepared for common things. Rare is always a rare. Okay, common things present as a rare entity. Okay, rare is always a rare. Now this is the only question which is out of the syllabus, and ignore it. Now compare and contrast the features of REM and non-REM sleep. So sleep physiology, from sleep physiology, physiology of sleep and consciousness is from the syllabus itself. So there's so many questions in the recent past from sleep physiology. So in 2007, the physiology of normal sleep. 2009, about the consciousness part. In 2010, define sleep cycle. What are the variations with each? In 2014, what are the different types of sleep? That is REM and now. What is the difference in sleep of newborn from old? And what is the neurophysiological basis of sleep in 2016? And in the recent past, in 2019, elaborate types and stages of sleep along with EEG findings. Describe neuronal and neurohumoral mechanisms. So sleep as an entity is very important, and this question is compare and contrast, like differentiate and also compare the features of REM and non-REM sleep. You have to tabulate this question here. Okay, rapid eye movement and non-rapid eye movement sleep. So we're done with question number 1. Except from question 1D, I think everything else is discussed. Okay, everything else is discussed, and I think you're ready for this question number 1 for part of UPSC Medical. Okay. Now question number 2, prostate, yes. Even in the grand test and even in anatomy test also, we do you remember there is McNeil classification of the prostate? McNeil zonal classification. McNeil zonal classification are lobes of the prostate, peripheral zone or central zone or transitional zone are lobes of the prostate. And what is the prostate? And prostatic capsule is very important, because capsule of the prostate and capsule of the thyroid, they have similarities. Like you can differentiate. While doing thyroidectomy, we are leaving out something. While doing prostate, we are leaving out some aspects of the capsule and all. These are all clinical points, important points. So we did discuss the prostatic anatomy in our classes. So they're asking you gross, lobes, capsule and ligament, blood supply, lymphatic drainage, and age changes. Age changes with the prostate is very important, because they're asking you what is BPH, benign prostatic hyperplasia and prostatic carcinoma, which are common when a person ages, right? Almost like they say 60 to 70% in their 90s and 100s, they end up developing this prostatic carcinoma, and many develop bladder outlet obstruction symptoms with BPH, that is benign prostatic hyperplasia. So it's more or less a predictable question. And in 2014, they asked about zones and lobes. Here there's a confusion whether to write zones or whether to write lobes. Lobes is the past. Currently we are following McNeil zonal classification. If you don't remember lobes also, you can write zones here. Okay, McNeil zonal classification. And they're clearly asking you what is the applied anatomy of BPH. So it's a repeat from 2014. Now, describe the key events occurring in the ovarian cycle. So menstrual cycle, you have to be thorough with uterine changes and also ovarian changes, what happens with the ovary, and also the hormonal changes which actually cause this uterine and ovarian changes. In ovary we have follicular phase, right? Okay, we have luteal phase. Similarly, in the uterus we have proliferative phase of menstruation, right? Endometrial proliferation, endometrial shedding and all. So be aware of this, is very important. And test for ovulation, always examiner's favorite thing, and we did discuss in class, and we also have discussed in the test, okay, in the test series and all. So this is again what changes takes place in ovary was asked in 2003. What are the tests which indicate whether the female is ovulating is asked in 2011, and explain ovulation, what are hormones which are necessary for it, and what are the tests, why it is important to know the ovulation time, because you can predict the fertility period, right? It's as simple as that. And explain the changes which take place during luteal phase of menstrual cycle. Okay, in the second phase of ovarian cycle is luteal phase. What happens to the corpus luteum or corpus albicans, or if it fertilates, what happens? So all these things are to be discussed. So this is like pretty easy question. And now PCR in the era of COVID, PCR stands out, right? We did discuss PCR in detail, the principal steps. It is also a question from the grand test and all, okay? The recent live grand test. Almost from the live GT, I could see almost 7 questions which are directly come. Okay, if you haven't attempted it, it's okay, fine. They're most predictable questions. But when I say COVID, in the recent part, there are many calls and messages from students like what to prepare because we are in the pandemic of COVID, and when we are giving UPSC, you might presume that they are going to ask some questions from COVID. But let me tell you, they're so honest people, right? They'll never go out of the syllabus. Even in this last 3 years of the COVID pandemic, there's not even a single question on COVID virus because that is not in the syllabus, right? In the last 3 years, maybe the general aspects, the general study aspects of COVID has been asked in the last year, when COVID is at its peak. But from medicine point of view, please ignore. But in the recent COVID handout, we did cover what are all the aspects of COVID which can be, like in an indirect way, can be asked. So those aspects are covered in even our live grand test also. For example, RT-PCR or PCR, because we do PCR tests for COVID, that aspect can be covered. Similarly, there are some drugs which were used in COVID, like chloroquine was used, remdesivir from ivermectin was used from antiparasitic. They might be from the syllabus, so they might ask the mechanism of action, side effects and all in such a way. And biomedical waste management is there in the syllabus, so COVID related biomedical waste management can be a potential question. That's the reason we covered it in a handout, and we also have asked the same question in the live grand test, right? So these are some of the COVID aspects which are potential questions, but definitely they'll not ask you what is the structure of COVID, what are the clinical features, how do you manage. But in Park latest edition, they have included COVID. In the Park, if you're reading 26th edition, it's not there. I think it's in the 27th edition, most latest. They included COVID. Okay, they have included COVID, but not in the UPSC's prescribed syllabus. So if a student asks me a binomial question, like if they want to like kind of yes or no kind of question, I'll tell them no, don't prepare COVID because that is not in the syllabus. And if they haven't asked in last 3 years, unless and until if it is included in the syllabus, they are not going to ask it in the future. Okay, but PCR is important, and likewise PCR was asked in 2001, 19, 13, 18 and 2019. See, 2019, if you have done 2019 previous year question paper, you are a lucky lad, because there's almost, I think, 22 questions which are either direct or indirect repeat from 2019. In a similar way, even 2020, so last 5 years itself, there's so many repeat questions. I'll give you the analysis at the end. Okay, so please bear with me. Let's try to finish off the paper. So whatever general aspects I want to give, I'm just adding up here. But most importantly, what are the principles and steps involved in PCR and applications are asked here, which is a golden repeat again. And write a note on different vitamins of vitamin B6. And every year there is 1 or 2 questions on vitamin. Last year they asked about vitamin B12 in detail, right? This year they're asking you vitamin B6, and there's other question on vitamin C. Now, when you're reading vitamins from nutrition aspect, you have to read it, because this is paper 1 section A question 2. They're asking it from biochemistry. So the same vitamins can also be asked from nutritional point of view from PSM, that is paper 2 section B also. That was done in last year. Like vitamin B12 was actually asked in paper 2 section B. So what is the difference here? When you're reading from biochemistry point of view, they'll ask you one simple question, that is biochemical functions. That means you have to give what is the coenzyme or cofactor which is associated with the particular vitamin, and what are all the reactions in which it participates. This is biochemical aspect of nutrition, right? And what the test which we do for urine detection or serum detection, that is the deficiency and all. And when they're asking from PSM point of view, they'll ask you deficiency manifestations, they'll ask you sources, okay? They'll ask you what are the health programs which are available for nutrition point of view. So they ask you question in a slight different way. Now you see what are the different vitamins or analogs of vitamin. This vitamin question was clearly asked even in the test series biochemistry question. So what are the vitamins of vitamin B6? This is again biochemical forms, and write their biochemical role. So please, it's very important to tabulate the sources, the biochemical functions, and also the deficiency manifestations of vitamins, starting from vitamin A to vitamin B12 or vitamin C. Yeah, because anything can be asked. Sources, biochemical functions, and deficiency manifestations. And the same question has come in 2015. What are the important functions of pyridoxine or vitamin B6? Pyridoxal phosphate, right? Very important one. And do you remember in ATT, while we are giving ATT drug, we also give pyridoxine to prevent peripheral neuropathy caused by isoniazid, right? So you can even write that. Yeah. Now, question number 2C2. Question number 2, it's, I think, fairly easy. Nothing is out of the box. I think you can easily attempt this. All these questions are straightforward questions. Now let's quickly see question number 3. Elaborate on hormonal regulation of blood glucose level. Okay, you have to write the interplay between insulin and glucagon, which are released from the pancreas, and how do they take part in regulation of the blood glucose levels. And explain in brief the signs and symptoms of hypoglycemia. They're not asking you hyperglycemia. They're not asking you diabetic ketoacidosis or hyperosmolar coma. They're asking you hypoglycemic coma, how a patient presents with hypoglycemia. We did discuss functions of the insulin. We did discuss overdose of insulin, what happens. We did discuss what happens in diabetes and how to differentiate hypoglycemic coma from other conditions and all. It's a clear-cut discussion, right? So this is too general from physiology point of view. This question is from physiology, the endocrine system, wherein the pancreas is an important organ, and insulin and diabetes are commonly asked. Hypoglycemia is like kind of, they have forgot about this hypoglycemia, because there was one question on hypoglycemic coma in 2012. We did discuss these differences and all, and there was one question on 1994, glucose hemostasis. How glucose is regulated in the body is like, if you're from medical person, you will understand what insulin does, what glucagon does. Because they're asking it for 10 marks, maybe you might face difficulty in framing up the content, because you can't give 10 marks of content unless and until you know exactly at what reactions, what happens, how kinases are how insulin acts at various levels, and how it regulates the carbohydrate or blood glucose level and all. You have to deep dive into that. But again, fairly easy question if you're prepared for it. Right. Weightage of this question is the only issue for me. Like, how can you extend it for 20 marks and all? Like, you have to kind of think about it. Now, as I told you, the vitamin C deficiency sources, daily allowance. Please, very, very important. In the table which you are making for vitamins, also include RDA. But again, I'm not a fan of memorizing stuff, right? Because you tend to forget unless and until you revise it in the last day of your. So I think RDA should be in your last revision booklet, right? And biochemical significance of vitamin C and clinical measurements of vitamin C deficiency. They are asked it in question 3, section A itself. So be ready with that. And similar questions in 94 and 2006. In 2016, they asked about vitamin C in scurvy and cholesterol metabolism role. And what are vitamins, and name diseases which are produced by deficiency of vitamin C was asked in 1994. So vitamins are vital. Vitamins are vital for your biochemistry preparation. Now, paper 1 section A, question 3C1, discuss the formation, course and branch of ulna. Now, brachial plexus. So day in and day out, upper limb, lower limb, nerve supply, blood supply. This is the only thing which I teach. Okay. Few of the students are very angry about, sir, why whole of the upper limb osteology, histology is not covered. Man, let me tell you, they have clearly given in the syllabus applied anatomy, including blood and nerve supply of upper limb and lower limb, and joints of shoulder, hip and knee. This is the syllabus. So when I say this, they are only asking you the blood supply and nerve supply of upper limb. Now you can even prepare blood supply of upper limb. But again, for me, as a clinician, if you are an orthopedician, you will understand. When a patient comes with upper limb injury, they mainly come with nerve injury. But when a patient comes with lower limb symptoms to a surgeon, they only come with gangrene or PVD or varicose veins. I think that's the main reason why we stressed upon only nerve supply from upper limb and blood supply from the lower limb in the varicose veins, PVD. Okay, and even sciatic nerve supply, lumbar. These are all the important aspects are discussed in our classes. But I won't teach you what are the muscles, what are the relations, what is the movements and all, because you can only prepare the shoulder joint because that is there in the syllabus. Now, Apart from that, Allah now, they have been asked like in 2005 and 2016, they did ask this question. So it's a repeat, it's a straight repeat. I think there's not even a single question except from intercoastal space which is not a repeat so far. Okay. So now don't ask me, sir, why some aspects of the syllabus are left out intentionally. I'm telling you, when they're not needed, when you're preparing for UPSC, you have to follow in a syllabus specific fashion and also PYQ centric fashion. That's what we do with our courses. Okay, focus on previous year questions, and we covered previous year questions from 1994 in our focus guide, and based on that we have recorded all the classes. Okay, from the 1994. Yeah. Now, even if you are an examiner, if you're asked to set up a paper, what will you do? You will just go through the previous year question. You will try to understand the pattern and you will twist, like kind of you can't just copy paste, right? When you're given a job, what you'll do, you'll just twist the question kind of thing. You'll come up with something, a new question with a similar lines. So the answer is always same. Only the question is the one which confuses you. Okay, and also weightage of the question is sometimes, because if you don't have so much of content, you cannot present it for 15 marks or 20 marks. So therein you have to bring in your artistic ability of answer writing, which if you are a serious aspirant, you are almost ready with GS, you have to apply the same aspect here. Okay, now question number 3, we are discussing question number 3. 3C1 is done, 3C2 now, 3C1 is Allah now, 3C2 is portal vein. Portal vein, there is a similar question on portocoval anastomosis, and this portocoval anastomosis is there in our test series discussion. Okay, it's a clear-cut question. Now, what are the sites and what are the anastomizing vessels and what is its applied anatomy? Simple, right? In portal hypertension, we have caput medusae, we have varicose, hemorrhage, bleed, esophageal varices and all. Why do they develop is the clear-cut answer, and this was asked in 2011 and it's a repeat again. Formation, tributaries. What are the sites of portocaval anastomosis? Portal venous system is anastomosing with the systemic venous system. Yeah. So question number 3 is also, there's nothing new here. Everything is simple except this 20 mark elaboration of the basic stuff from physiology. Now, diabetes, right? Chronic disease, a commonly seen disease, and I think you should be able to present it in a understandable fashion. Now, the last question from section A. If you are newly going through this question paper, we all know section A includes anatomy, physio and biochemistry, right? So just I'm giving you the basic details. Now question 4 is absorption and hormonal regulation of blood calcium. Okay, so calcium phosphate interplay from endocrine physiology is like a favorite question. 96, 2004, 2018 and even 2019 they asked about calcium and phosphate regulation. The same question they're asking, and also the clinical manifestations of hypocalcemia. I told you, right, 2019 paper is like a golden duck for this exam. Now question number 4b, describe the key mechanisms for regulation of cardiac output. Describe the key cardiac output factors which regulate cardiac output and exercise changes associated with cardiovascular system. These two topics are discussed in detail in our classes. The same question was asked and it is a repeat. 94, 2000, 2003, 2009, 2010, 2012 cardiac output and cardiac index, and in 2019 what are the various cardiovascular changes which are done during exercise. The same, instead of asking just an exercise, they are giving you isotonic exercise. We have isotonic and isometric. There are not many changes. If you can't differentiate isotonic from isometric, definitely you have to just give the changes which are associated with a normal exercise, right? And anyway, we're gonna do a detailed discussion on each question, what should be the answer, how to present it, along with the notes will be given to all the course takers. Okay, so no need to worry about how to present this, but overall the intention of this video is to just let you know that these are the questions which are there. So they are not a nightmare or they are not a surprise. Okay, they are from the previous year questions, and the whole of our course is based on the previous year questions. Okay, now write in brief about hepatic segments. Now coinoid segments of liver is our grand test question. Okay, coinoid segments of liver is our grand test question. From the liver we have gross anatomy. From the syllabus point of view, in the liver they are asking you gross anatomy, blood supply and lymphatic drainage. From the blood supply they already asked you the portocaval anastomosis part, right? So now from the gross anatomy, the liver, we have right lobe and left lobe of the liver, but within the liver we have so many segments. Right is divided into some segments, left, so we call it as coinot segmentation of the liver. Based on this, the surgeons will operate, like which lobe to segment 4 or segment 4A, segment 4B and all. We have a clear discussion video on this coinot segmentation. We also ask this in the grand test, okay, though it's not a repeat, it's a new question, but we did cover it in the grand test part now. And even in the recent, I think this handout 0504 are, I think they are pretty useful. I don't know, but many questions has come from this recent handouts. In the last minute handouts, the 06 and also 05, there's so many questions which got repeated. It's the coinot segmentation was there in that handouts too, which was given to the students. Now, question number 4C2, enumerate all cranial nerve nuclei with their functional components. Discuss functional components, nucleus, course, distribution of 7th cranial nerve. See, so far they asked cranial nerve 4, cranial nerve 7 they asked, okay, from the cranial nerves. So what is there in the syllabus? In the syllabus, from the cranial nerves, they are asking you cranial nerves, distribution and clinical significance. Clinical significance. So for the next upcoming exam, every year they are coming up with one cranial nerve. Even trochlear nerve was asked, facial nerve was almost asked 4 to 5 times, I think. Facial nerve was asked. Now instead of asking a specific cranial nerve, they are asking you enumerate cranial nerves. I think you are ready with many codes, okay, how to remember cranial nerves 1 to this stuff and all, whether they are sensory and motor, okay. Many says money matters, but my brother says biology books matters more. This is how I remember cranial nerves, okay, 1 to 12, and the names of the cranial nerves. But what is this functional component? Functional component is, you have to say whether it's a general somatic efferent or visceral special, sorry, not somatic, general special or visceral special. So this kind of functional components are there with each of the cranial nerve nuclei, and they're asking you to tabulate it. Like, what is the functional component of 7th cranial nerve, right? In a similar way, I think you need a tabulation of what is its function. Don't just write function. Functions are easy. We know what ophthalmic nerve does. We know what oculomotor nerve does. We know what trochlear nerve does. What facial nerve does. They're asking you functional component. Whether it's a visceral efferent or a general somatic efferent, or it's a special one or a general one, you have to be pretty sure about this. Okay. Now, this is question number 4C2. So we're done with paper 1 section A question 4. This is kind of surprise element in question 4, but apart from that, this is not a repeat again. But rest of the questions are straight down repeats and very easy to write. Calcium level stuff, cardiac output. So major chunk is from physiology in question number 4. Protocol anastomosis. Ulna now is very easy question, and vitamin C deficiency can be done. And okay, so not vitamin C, 4A. So these are the questions. So paper 1 section A question 4, apart from 2 to 3 questions, rest are all like they are very easy, and they are the repeats. Okay. Now let's do a bit fast because it's already been 30 minutes, and if you're not getting the logic behind this discussion, I think few of you will be already bored. But this is very important to understand what type of questions are getting repeated, so that you are ready for the upcoming 22 or 23 exam, right? So paper 1 section B, I'm going very fast. Metastasis. Okay. So benign versus malignant tumor or neoplasia. So define neoplasia. Benign versus malignant tumor is examiner favorite question. In a similar way, we also have from the syllabus, from pathology point of view, differentiate primary cancer versus metastatic cancer. How metastasis occurs? They asked it many times. Like in the 2018, what are the steps which are involved in hematogenous spread of a tumor? Metastasis occurs in many ways. It can be in hematogenous fashion. It can be in lymphatic spread and all. It can be a peritoneal spread. They're asking you what is metastasis, the same question, but different pathways of spread of cancer. And what are the features of malignant tumor? Discuss pathways of cancer spread. What is the mode of cancer spread? How do you differentiate a primary from metastatic malignancy? So all these are like included in this question from the recent one. That is, define metastasis. What are the steps involved in metastasis? Role of stromal elements in the metastasis. So a little depth into the topic of metastasis. The question number 5B1 is from immunology point of view. This is always this confusion. Okay, immunology, our immune system is discussed both in micro and path. Okay, micro and path. When I am doing my MBBS, I used to read most of the immunology from the micro textbook because it is easy to understand. Okay, in the path they go, the Robins, they'll go to such a depth, sometimes we lose the track. Okay, so I usually prefer to read from micro textbook, but irrespective of whether it's from micro or path, immunology itself is a separate entity. You have to discuss it separately, the immune system part. And from the immunology, they only asked one stuff, that is what is cell mediated immunity and what is the differential cell mediated immunity from humoral immunity. When I say humoral, immunoglobulins are the major part of the humoral immunity. When I say cell, T lymphocytes are major part. So the question is both. Explain the function of immunoglobulin and what are the subsets of T lymphocytes. So similarly, 2010, 2012 and 2015 also, what are the various cells of immune system? How do you classify lymphocytes? What is cell mediated immunity? What are immunoglobulins? What is their role in communicable diseases? It's like what is humoral immunity, or antibody mediated immunity, they're asking it. And what is the mechanism of action of immunoglobulins? I think it's almost, the question is almost in the similar lines. But again, functions for 2.5 marks and subsets of T lymphocytes, that is T lymphocytes are again T helper cells, right? T helper cytotoxic T lymphocytes. You have to differentiate them. Question of paper 1, section B, question 5, 5B2, amoebiasis. How do you differentiate intestinal from extraintestinal manifestations? See, the microbiology, the one thing you should be aware of is the lab diagnosis part. Lab diagnosis. Okay. Lab diagnosis. But in the syllabus, what is the other keyword which they give is diseases caused by and laboratory diagnosis of. This is the like the heading which they gave. Diseases caused by and the laboratory diagnosis of. So, what are the diseases which is caused by meningococcus, salmonella, shigella, herpes, dengue, polio, HIV, malaria, histolytica, giardia, candida, cryptococcus, aspergillus? These are all the questions which are there. So, from amoeba, what they are asking you is what are the manifestations. So, diseases caused doesn't mean that what disease does it cause. Along with that, what are the manifestations? So, while discussing pathogenesis of each condition, so pathogenesis, it ends with clinical manifestations. Like for example, you take salmonella, it enters through this intestine, so it permeates through it. There is primary bacteremia, late secondary bacteremia, then clinical manifestations. What clinical manifestations? Bacteremia leads to development of the fever and chills and all the step ladder pattern fever. But again, main clinical manifestation is transverse ulcers in the intestine, intestinal ulcers leading to the abdominal pain, loose motions and all. So this is how you have to write down the manifestations along with the pathogenesis. So for all the diseases we did discuss the pathogenesis, okay, concluding with what are the clinical manifestations and also what is the lab diagnosis, how do you diagnose it. So usually they'll not ask treatment, but again there are some questions in the past for which treatment is asked. I'll tell you why. From micro point of view, we have almost, they're given in the syllabus almost 12 organisms, okay, including bacteria, virus, parasite and fungi in the syllabus. Not only that, we come across these infectious organisms even in infectious diseases part of general medicine. Therein they'll ask you treatment of. In the general medicine there are some infectious organisms. It's clearly given in the focus guide. I'll be adding the link to the focus guide below, okay, because I have already added important like the 2021 the latest questions into the focus guide and edited it. I'll be adding it as a link in the description. But again, what is the thing that you need to understand is not only from microbiology, there are some diseases from PSM wherein you will have National Health Program aspects like tuberculosis, right? Filariasis, rabies, and all, they all come from PSM. Similarly, they also come from the general medicine point of view, because in the general medicine, the infectious diseases part, we have some diseases like TB, tuberculosis, management of the TB, and we also have typhoid, we also have rabies, we also have AIDS, dengue. So they might ask you the treatment of these diseases, dengue, cholera, because in the syllabus they give etiology, clinical features, diagnosis and management, and preventive measures. So don't get confused whether it's, even if it is there in the paper one, they might ask you how do you manage or how do you treat extraintestinal amoebiasis suddenly. They'll not ask amoebiasis question because this is not there in the paper too. But if it is salmonella or typhoid or rabies or AIDS or dengue or cholera or Japanese encephalitis or tuberculosis, they might ask treatment here and itself, even though it is not in the syllabus. This is called, I could say, kind of vertical integration between paper 1 and paper 2. Right? This is the area where. So even while we're discussing microbiology in our course, I have included the infectious disease discussion there and then itself. Similarly, I want to tell you all, the test 1, the subject-wise test, includes microbiology. It also includes infectious diseases aspect. So don't be worried if you suddenly say what is the treatment and all, because I have integrated the paper 2 section A, general medicine, infectious diseases, here with the microbiology. I think this is how you should learn. Okay, so etiology, clinical features, diagnosis, management from general medicine, diseases caused by or pathogenesis, and lab diagnosis from microbiology. When you club them together, I think you're ready for this exam, from at least from infectious diseases point of view. Now, coming back to the question again, intestinal and extraintestinal manifestations of amoebiasis. Again, we have the same question in 2012. They asked about pathogenesis. Now you see, now they're asking what are the manifestations. So diseases caused by is not different from pathogenesis. Just you have to end it with the clinical manifestation. Similarly, pathogenicity and lab diagnosis of amoebiasis. Pathogenesis and lab diagnosis of extraintestinal. They clubbed these two questions and asked it in a different way here for only 5 marks. Okay, even in 2022, so it's a direct repeat. What is the lab diagnosis of intestinal amoebiasis? Differences between amoebic and bacillary dysentery. It's an indirect repeat, I could say. Now, paper 1 section B, question 5, discuss about longer acting insulin analogs. It's a straight question from our pharma subject wise test. Discuss about the longer acting insulin analogs. How are they different from insulin preparations? And mention the therapeutic uses and adverse effects of insulin. I think insulin is again a very important topic. Within diabetes, you see, diabetes they asked the physiology, now they are asking about insulin from the pharma. Okay, pharma, last year they asked about anti-diabetic drugs classification and how to, about sulfonylurea. Now they are asking insulin preparation. I think diabetes, tuberculosis, I think both of these topics should be there in our question paper, because we are Indians, right? In India, these are the rampant conditions which you see. So you need to be thorough with these conditions. Now, a similar question in 2009, insulin analogs, mechanism of action and advantages, and in the subject-wise test we did ask it. Question number 5D, from pathology, we have this topic called inflammation. Okay, inflammation, acute and chronic. What are the inflammatory mediators of acute inflammation is most commonly repeated question. And from the chronic inflammation, one manifestation of chronic inflammation is granulomatous inflammation, right? So both these aspects are covered with us, but this question is quite different, because little bit different, because they're asking you what is chronic inflammation, what are the causes of chronic inflammation, and what is the role of macrophages in chronic inflammation. They went it more general. So some questions are a bit top of the layer questions, like they're so general, and some, there's not even a single question which is in depth. So mostly they went in the written order, like they went superficial instead of going deep into these topics. So what is chronic inflammation, what are the causes, and what is the role is like, I think it's a day in day out question, like very easy one to answer. So in the pathology, from the inflammation point, focus on inflammatory mediators for sure, and also what is acute inflammation, what is chronic inflammation, the differences part. Very important. So from inflammation and repair, so focus on the things which I just told you. Now again, granulomatous inflammation, which is chronic inflammation, was asked in 98 and 2012. Now, from forensic, question number 5. Okay, enumerate data of identification and write a note on fingerprinting. There's a confusion here again. So whether it's a DNA fingerprinting or fingerprint study. Because in the syllabus, why I am stressing upon the syllabus? Because syllabus is like Gita, syllabus is like Quran, because they'll never go out of the syllabus. They only play here and there with the terminology and words, but they always focus on. So in the syllabus, it is given clearly that this is the identification. Identification can be a DNA fingerprint study, DNA and fingerprint study. So this is what is given. Now, when you look at previous year questions, they are always asking DNA fingerprinting, DNA profiling or fingerprinting, and what is the DNA bill and what is DNA bill. I think even this question is also on DNA fingerprinting. So don't worry about what are the types of fingerprints which are there on your hands. Okay, focus on DNA fingerprinting. So direct repeat. Now, question number 5, it's a lengthy question, must attempt question, because all the aspects like forensic medicine, pathology, pharmacology, microbiology, immunology, and again the pathology, all this are asked, but everything is a repeat, nothing is a new, like as you can see. Okay, you can easily answer this. Now question number 6, let me go fast. It's been 45 minutes now. Define ischemic heart disease, enumerate 4 ischemic syndromes, discuss the pathogenesis of MI, briefly describe infarct modification by reperfusion. So in the syllabus, in the pathology, ischemic heart disease is important in 2 aspects. One from pathology, the other from pharmacology, like management of ischemic heart disease by anticoagulants and all. Okay, and pathology, pharmacology, and other from general medicine, that is MI, management, stable and unstable angina, because from MI also there's so many questions in the part 2. And pathogenesis and pathology of ischemic heart disease was asked long back in 1999, and the question has come again. Here in this question there's a little twist here. There is another topic called reperfusion injury, because reperfusion therapy is the commonly done treatment, right? PCI stenting is the way we reperfuse, or we use thrombolytic therapy and all. When we do that, how does infarct get modified? So they're getting into the deepest parts of the pathology, what happens. Apart from this, definition, ischemic syndromes and pathogenesis of MI is already discussed. Okay, so don't worry about that. What happens with reperfusion injury when there is an ischemic penumbra, when reperfusion occurs, the ATP come back and all these things are in detail, but apart from this 5 mark question, the rest of the 15 marks were already discussed. Okay. Question number 6b. See, this some confusion from pharmacology. Please make a note of this. Pharmacology, we have mechanism of action. And we also have side effects. This is what is given in the syllabus booklet. Mechanism of action and side effects of antipyretics, antibiotics, antimalarial, antichalazoid, antidiabetic, rest of the things. But when you look at previous year questions, therapeutic uses and drug interactions. Okay, drug interactions. So these are the 4 headings you need to prepare. Though they haven't asked you, like they haven't given you in the syllabus booklet about therapeutic uses and drug interactions. There's so many questions on explain why amyloid should not be given with the digitalis. Explain why, explain this, explain that. So there's these kind of questions. Like even here, they're asking you therapeutic indications and drug interactions and side effects. So side effects is anywhere there of methotrexate and furosemide. So diuretics is in the syllabus, antidiuretics, diuretics, and methotrexate is also in the syllabus. Now, similar questions in 98 about methotrexate, furosemide, classified diuretics in 1999, methotrexate, furosemide. Explain why furosemide should not be administered with aminoglycoside. So this comes as a drug interaction. And folic acid is administered along with methotrexate. This again, what happens and all. So these kind of questions are not new. There's many repeats in this. So methotrexate and furosemide are like kind of important ones. Now, discuss the importance of CD4 cell count and viral load in HIV. So from microbiology, HIV lab diagnosis is very important. Instead of asking you the lab diagnosis, they went into asking it more specific. For example, in 2020, they're asking you only how do you diagnose this in a window period. They're like the P24 antigen assay. Now they're only asking what is CD4 content. So there's so much of study into lab diagnosis of HIV. There's so much of data coming up. So you can't just by heart only the top-notch facts or the key synopsis point of view, because HIV, as I told you, tuberculosis, diabetes, in the similar line, HIV comes into picture because being a chronic disease and it kind of in epidemic proportions. So HIV also, the lab diagnosis part, they went very specific. They're asking you what is the importance of CD4 cell count and viral load, okay, in HIV infection. So CD4 cell count, when it comes down, what kind of infections do you see? How do you assay CD4? What is CD4 is to CD8 ratio reversal? Okay, why do CD4 cell count comes down? And what is the viral load? When it increases, what happens? This is though it's a repeat, it's an indirect repeat, and it's kind of, I could say, out of the box question, okay, but though it is in the syllabus, you have to get into some depth to write this, okay. Now question number 6, C2, describe antigenic structure of Salmonella typhi. Simple, Vidal test. Okay, what is H antigen, what is O antigen, how do you detect it, paratyphi A, paratyphi B and all, how it helps in diagnosis of enteric fever cases and carriers. So they're asking you define antigenic structure so that you can come up with Vidal test. So in the lab diagnosis, instead of straight away asking what is the lab diagnosis, for upcoming batches from 2020 to 2023, I think we have to deep dive into some specific aspects of lab diagnosis, kind of, because lab diagnosis is there in the syllabus, but you can't just write overview of lab diagnosis now. So now after this, I think we should be ready with some depths of lab diagnosis. Similarly, what we did in the last year there's questions on drugs in pharmacology. We all used to preparing first line drugs in each classification. For example, when I say diuretic, most of the time they all only ask furosemide. So similarly, when we say antibiotic, they mainly ask penicillin or cephalosporin. Like they won't go into. Similarly, anti-diabetic means they ask metformin and sulfonylurea. The key first line drugs were asked, but last year there was a surprise. Instead of asking ketoconazole, they're asking fluconazole. So second line drugs or modifications were asked, which is rare again. And this is also rare. Like for example, for all these 12-13 microorganisms, you can't go to such a depth of understanding the lab diagnosis. If you have time, if you are preparing, if you have 2 years of time, just go for it. But if you are an immediate aspirant for 2022, just overview is enough, because whatever is the question, the antigenic structure, you know Vidal test, which is very important. Similarly, whatever is about CD4, you know the lab diagnosis of HIV, you can present it there, okay. That will definitely give you more than 5 marks, and at the end of the day, you have to score 300 out of 500, not 500 out of 500. Please remember this, okay. And you have a choice. You only need to write 5 out of 8 questions. So choose wisely. Choose wisely. You're going to become an administrator, not a doctor. Please keep it in mind. Your goal is to become an administrator. Your goal is not to master medicine and know everything. Okay, you're never ready for this exam. Don't try for sense of completion in this exam. This is very important. So this is kind of a bit difference with lab diagnosis. Kind of different questions were asked. Now, question number 7. Define poison and classify it. Describe the treatment of venomous snake bite. Similarly, envenomation, snake bite and all was asked in 2002, and the same question was asked in our subject wise test, like in the toxicology point of view. This is new. Designer drugs are similar to, see, when I say this designer drug, these days, see, toxicology is there in the forensic medicine and toxicology syllabus. They only gave heading as toxicology. I think it is the most unspecific or non-specific way. There are very few areas wherein they just gave it like toxicology. Now there are almost 100 plus toxic drugs. You can't just go and learn everything, right? So that's the reason we only covered some of the important, like from envenomation, snake poisoning and scorpion bite, the common things. Similarly, from organic poisonings, we covered OP poisoning, which is more common, arsenic poisoning, lead poisoning, and more importantly, psychotropic drugs are nowadays gaining a lot of importance. Even last year also they asked about what is the drug menace in the country, addictions and all, de-addiction. So many drug addiction cases are like questions were asked in the live grand test which was conducted recently. But what is designer drug is a new concept again. I think if you are a serious aspirant, if you are preparing seriously for general studies also, you might have come across somewhere in the Hindu articles or like designer drug, just to mislead pharmaceutical vigilance. What they are doing is, it might be of a different formula, but it works like morphine. So these are the designer drugs, chemically different, but function wise they act like psychotropic drugs. They cause dependence, they give euphoria and all. So these are the designer drugs. You may need to add some more list. I'll be giving them in our discussion of paper, right? The detailed discussion in the course. So don't worry about that. But overall, if you're reading newspaper regularly, somewhere else you might have found out that a designer drug has come. So whenever in the Hindu paper you read about drug, okay, dependence, okay, because these days drug scandals have become so common in the paper, with Sushant Singh Rajput death. After that, the whole of Bollywood is under the drug menace, right? So maybe they're gonna repeat this pattern every year. So be thorough with whatever happens with drug from medical point of view, from current affairs. So this is kind of integrating your medical science optional with general studies. This is the key area. Now snake poisoning and all. Treatment of venomous snake bite is going to carry important, and generally what is poison and classify it. We have kind of whatever is there in the Reddy's textbook of toxicology, organic, agricultural poisoning, sedatives, hypnotics and all. You have to just write that classification. Now paper 1 section B question 7B1, oral cancer. Oral cancer is there kind of in both pathology and surgery. Okay. So this question is from pathology. They are only asking you the pre-malignant conditions which predisposes there, pathogenesis, molecular basis and morphology of oral cancer. Similarly, what is etiology, malignant lesions? So 2002, 2010, 2013 and 2014. This is like a repeat question. Paper 1 section B question 7. Describe the pathologic responses of the glomerulus to injury and pathogenesis of glomerulonephritis. See, glomerulonephritis is again therein two areas. Pathology, they're asking you only the gross and microscopic stuff like the morphological aspects and the histopathological aspects or pathogenesis aspect. Now in general medicine, they're asking you to the etiology, clinical features, okay, management aspects. So many questions have come from this aspect, like what is nephrotic syndrome, what is nephritic syndrome, what is post-streptococcal glomerulonephritis. But many questions have also come from what is membranous nephropathy, what is rapidly proliferating glomerulonephritis, what is membranoproliferative glomerulonephritis. These two questions and this question, they are there in the notes. These are asked in the grand test, okay, even in the live grand test, membranous glomerulonephritis was asked. So you have to just give how glomerulus responds to an injury and what is pathogens of glomerulonephritis. Similar question was asked in 2006, kind of a general way of asking a question from this, from pathology. Now question number 7C1. General question, what is antimicrobial resistance? So now we have from pharmacology, general pharmacology question, that is in the antimicrobial drugs, they are asking you general aspects. In that you need to understand, classify antimicrobial drugs. Second thing is what is the general mechanism of action of antimicrobial drugs, and third thing is what are the adverse effects, general adverse effects associated with antimicrobial drugs. Similarly, you have to be aware of what are the general toxicities of anti-cancer drugs, what are the general kind of classification of anti-cancer drugs. So in a similar way, antimicrobial drugs classification, general mechanism of action and adverse effects. You need to be thorough with this. So the same question they asked, general mechanism in 2014 and adverse effects in 2018. Now they're asking you, very importantly, the resistance pattern, because antibiotic resistance, this problem is rampant nowadays, right? So antimicrobial stewardship, like in the hospitals, we have a circular or we have education about how to use an antimicrobial to prevent the development of resistance to the 4th generation drugs which we use, because at the end of the day we don't have any other antimicrobials left, right? To at least to tackle hospital generated or hospital acquired infections, right? So antimicrobial resistance is a problem, and they're asking you what are the mechanisms of antimicrobial resistance. Now name the third and fourth generation cephalosporins. So antimicrobial drugs, the same question, and the therapeutic indications. Similarly, cefotoxin and ceforam are asked in the past. So penicillins and cephalosporins, please focus on these drugs. Okay, beta lactam antibiotics. So question number 7 is done. So now question number 8. I thought that I can pull it off, but again, even the paper 1 discussion itself is taking an hour. But let's try to stretch, because I want to put everything in a single video. Okay, I think I have given you enough important points in this 1 hour of discussion. Okay, so question number 8, A1 is describe the uniqueness of pulse polio program in India. Polio per se is from both aspects, like microbiology and PSM, but in the PSM they haven't ever mentioned about polio as a separate topic, right? So the polio is eradicated. Okay, polio is out of the box, but the reason for its eradication is like the pulse polio program which we follow in India. So that's very important. Why do we follow this pulse polio program now? So nowhere else polio was given in the PSM part, but preventive aspects of polio virus have been asked in the past. So while we're discussing polio, I covered many things like polio switch, vaccine derived poliomyelitis, what happens and all. General aspects of polio were covered. So this question, what is the uniqueness of pulse polio program? I think you should be a better person to answer than me as a clinician, right? You are a serious aspirant, you are preparing for general studies, and these kind of health stuff, the uniqueness of how it is conducted, like what is the uniqueness, what are the implications, like the advantages, outcomes, what is the way forward and all. I think these are the headings which you will be using for your mains answer writing, right? Just go in that lines. I'll be giving you the answer again in our the notes part, but again I think for you are a better person to answer this than me. Okay, I'll be a better person to give you epidemiology, pathogenesis and lab diagnosis, which I already did in the notes. So this question is 2019. So though polio is eradicated, it's not eradicated from our question paper. It is still there. Now question number 8A2. A 28-year-old. So don't worry about a clinical question. When you see a clinical question, try to find out the keywords in the question. So what do you see? Presentation is headache, fever, fever with headache, maybe meningitis, fever with headache. Similarly, irritability and confusion, so maybe meningoencephalitis. Okay, and CSF is showing WBC, so infection in the CSF is meningitis again, but predominantly you are seeing lymphocytes and yeast. So there is a clue, yeast. What is there in the syllabus? We have cryptococcal meningitis. Cryptococcus is seen with a capsule on the Indian ink preparation. So probable diagnosis is cryptococcal, but don't directly jump to it. You have to give differential diagnosis and lab diagnosis. Because cryptococcal is an opportunistic infection, there should be diabetes and something else as a predisposing condition in this 28-year-old man. So try to give that reason and what is the treatment. Now similarly, pathogenesis and lab diagnosis was asked in the previous years. Even the latest question in 2020 also, lab diagnosis of cryptococcal meningitis was asked, but this time they asked it in a clinical fashion. Okay, so don't worry about the clinic. You have to learn the pattern to write, but overall the answer is same. It's pretty simple. Now question number 8B1, injury and hurt. Define injury, give a section, hurt section. Now what are the classes of grievous hurt? Define hurt. 2011 also, what are the clauses of grievous hurt in 2016. So it's a repeat, hurt. So from the forensic medicine point of view, injuries are always important, though it be a gunshot injury, entry wound and exit wound, and though it be hurt or injury. And asphyxial injuries, like you see, next question is what is asphyxia, what are the types of violent asphyxial death, what is sexual asphyxia, and again seminal stain. So blood and semen study, blood and seminal stain study. Without a question on this, there is no paper. See, 20, 19, 16, 13, 14, 3, 2000. So there's so many questions on seminal stain, but in the recent past in 2019, they asked about what is violent asphyxial death. So do learn the topic asphyxia in detail. Okay, we did cover hanging, we did cover strangulation. So these are they, definitely. We did cover difference between hanging and strangulation. So now they're going into the more details of asphyxia, like what is asphyxia. They might ask what is throttling and all, and like violent asphyxial death, what are the various types and all. You have to get into the details of it. And finally, question number 8C1 is from pharmacology. Discuss the artemisinin based combination therapy for the treatment of malaria. Artemisinin. Why do we use artemisinin from malaria? Similar question was asked in 2019. Like, instead of they're asking a straight question, they're asking you that why artemether lumefantrine combination is used for malaria, and why it is used. Like, when you give this tablet, why do you ask them to take with fatty food? Okay, so this is the topic. 8C1, discuss artemisinin based combination therapies. So anti-malarial drugs, we used to give chloroquine, but most of it is chloroquine resistance. Now you have to go for ACT therapy. Okay, artemisinin combination therapy. So now we're done with in 1 hour of discussion. We're done with paper 1, section A and section B. You can take a break and come back again for paper 2, but I'm going to continue the discussion in the same video, right? Okay, so paper 2, section A, this includes general medicine, dermatology, pediatrics, and in the general medicine itself we have medical imaging and we have psychiatry included into it. Okay, they are not separate, but look at this derma is like these days like highly scoring one. Almost 35 to 40 marks are coming from the dermatology itself, and there are only hardly 7 or 8 topics, 6 or 7 topics from dermatology. If you're thorough with irritant, that is dermatitis or eczema part, okay, if you're thorough with psoriasis, scabies, lichen planus, and again erythema multiforme, toxic shock syndrome, we have that also, right? Stevens-Johnson syndrome, sorry. I think these are the only topics which you have. And finally vitiligo. Out of 6, there will be 4 questions from it. Out of 6 topics, you are going to get 4 questions, right? Very important one. And even in pediatrics also, it's a highly scoring subject. Though the questions are pretty clinical, the topics are the same. Like acute respiratory insufficiency protocol or acute respiratory distress, hyaline membrane disease, respiratory distress is the one. Second one again is diarrhea. Third one again is severe protein energy malnutrition, PEM. Okay, protein energy malnutrition, and cyanotic congenital heart disease. I think these are the 4 topics. 3 out of 4 topics are asked in every exam. If you are thorough with this, and one more thing, I'm very important, neonatal jaundice. So 3 out of 5 or 4 out of 5 or sometimes 5 out of 5 questions will come from these topics. So like almost most of them. And from general medicine also, there's not even a single paper without a question on management of myocardial infarction, right? Very important one, like almost 20-25 marks. If you know only these topics, you are going to crack this paper to section A, irrespective of which background you belong, what background knowledge you have. If you are from medical fraternity or if you're a biology student, I think paper to section A is easy. But there is so much of confusion around students about clinical paper. See, whatever is the clinical question, the answer comes from only these topics. If you are thorough with this, you should be able to interpret question in an easier way, and you have to present it answer in a presentable way. That's it. That's what you have to do. Now, with this background knowledge, let's come back to medical imaging aspect of general medicine. This question, even in last year also, 2019, the last but 1 year, they asked about role of ultrasound in the management of liver abscess. We did discuss medical imaging under 3 headings. Ultrasound, MRI, CT are the aspects which we did discuss. But again, within this, we did discuss the principles and indications. But here they are going ahead and they are asking you on a specific condition. But why liver abscess, breast abscess, nowadays we are doing repeated aspirations under ultrasound control to control them. So ultrasound has been nowadays is more therapeutic than diagnostic. So ultrasound has been more therapeutic nowadays. So how do you proceed with this out of the box question here? They are asking you role of ultrasound in the investigation of pain in right hypochondria. So abdominal pain from general surgery, we did discuss the DD of each and every aspect, right? So right hypochondrium, mostly the pain in right hypochondrium is maybe because of the gallstone or gallstone ileus, right? One of the main key element. The other is again liver infection or liver abscess. Again, this comes into handy writing out this 2019 answer, like how do you evaluate and all. What else do you see there? The colitis, the colon part there will also, and also the renal stones. Definitely renal stones we don't use ultrasound much, but for gallstones and liver abscess, ultrasound plays a key role, right? And if it is traumatic and all, focused assessment of sonographic fast assessment will also help you. Any diaphragmatic irritation will also. So this is the brief general conditions which we all seen there, and to discuss the role of ultrasound in detail, I'll give you that answer in the booklet. But here, though it's out of the box question, if you are ready with 2019, it's okay. But what we discussed is the principal uses and therapeutic indications of each and every medical imaging, which is important for this exam. Now, question 1B, outline the pharmacological and non-pharmacological treatment of depressive disorders. So these days, from psychiatry, the anxiety disorders and the depressive disorders are commonly asked. In this, they're asking you from the management, they're asking you what is the pharmacological and non-pharmacological. Non-pharmacological plays a key role, right? Cognitive behavioral therapy, reassurance, psychological assessment, psychological support, prevention of the suicides by counseling, okay, dietary modifications. All this plays an important role. We usually tend to forget as doctors, right? So the pharmacological part, everyone is aware, like antidepressant drugs or antidepressant medication, how to go ahead. But non-pharmacological treatment, you have to elaborate. So they're going to give you only 5 marks for your basic knowledge, whatever you have from pharma aspect. But the non-pharmacological aspect, they're going to give you 5 marks for the CBT, whatever you use. So depression, anxiety are the two important parts of the syllabus from psychiatry. The other is, again, we have electroconvulsive therapy. Electroconvulsive therapy is there in the syllabus from the psychiatry aspect or psychiatric syllabus. And the one more topic which is there in the syllabus is schizophrenia. Only 4. From these 4, they're going to ask you 1 or 2 questions. Now, this time they only asked this question, that is the treatment of depressive disorders, pharmacological and non-pharmacological. Similarly, instead of clear-cut diagnosis, they might give you a clinical question. 45-year-old lady after the death of her husband 2 months back is feeling lonely and remains alone. Enumerate the likely conditions, that is the depression, post-traumatic stress disorder and all. How will you diagnose and manage major depressive disorder? The same question, if they give you clinical condition, don't worry. Okay, you know the answer. A young 23-year-old lady had attempted suicide thrice in last 1 year. Okay, suicidal tendency. What is the cause of her? You have to write the causes for suicidal tendency first, then give provisional diagnosis as post-traumatic stress disorder or severe depressive disorder. How do you diagnose? We do from diagnosis aspect. Please remember, from psychiatry diagnosis, we use DSM-5 criteria for diagnosis, because psychiatry there's no test per se. We won't be using neurotransmitter assay or study or electroconvulsive therapy first, or electrodiagnostic techniques or EEG for diagnosis of psychiatric. Psychiatric disorders are clinical diagnosis. So that's the reason when they ask about diagnosis or when they ask about clinical manifestations, you have to always give DSM-5 criteria. For mania, for depression, for bipolar disorder, for anxiety disorder, whatever it is, post-traumatic stress disorder or obsessive compulsive disorder, in future they might ask that question. So in all this, beware of DSM-5 criteria. So how do you diagnose this? DSM-4 criteria. And also management. Again, when they ask management, don't just give pharmacological management and stop it. You have to also mention non-pharmacological management for these questions. So question 1A, though an outlier, but question 1B is an easy one. And question 1C, tachypnea, chest retractions, grunting within 30 minutes of a birth, preterm birth, preterm hyaline membrane disease. Term, we might think of transient tachypnea of newborn, right? Maybe, but again, for preterm hyaline membrane disease. Now, most likely diagnosis is, when you're starting diagnosis, make sure that you start with DD, then give provisional or most likely diagnosis. Okay, DD can be respiratory distress of cardiogenic or non-cardiac or respiratory causes. Mention all the relevant causes. Then support your diagnosis. Just most likely diagnosis. My most likely diagnosis in this case is hyaline membrane disease or respiratory distress disease. You can't just write it and go away. They'll not give you 5 marks for this question for that. What you need to do is, you have to mention the basis for your diagnosis, which is clearly given here, and also briefly the pathophysiology of the condition, why it happens, why there is respiratory distress, because you have to say that surfactant will not form at a preterm level. It might take 34 or 36 weeks. That's the reason we give maternal corticosteroids for lung maturation, for surfactant production. So surfactant deficiency is the pathophysiological aspect of this disease. And how do you manage respiratory distress syndrome? By surfactant replacement therapy, by ventilation support and all. You all know that. We did clearly discuss it in detail. Okay, so it's only for 10 marks. But again, as I told you, from pediatrics, the most predictable topics are 5 or 6, and out of this 2009, 2010, 2015, 2017, 2018, and here again our champion 2019. So there's so many questions from this same topic, but in a clinical scenario. So don't worry about the clinical scenario. At the end point, from any clinical question, they will only ask you 3 things. What is your most likely diagnosis? And how do you support your diagnosis? By doing what investigations will you do? And how do you manage this case or treat this case? Only 3 headings. So whatever is the question body, it comes from the syllabus and in the most predictable fashion. You only need to give these 3 things. Now don't worry about the clinical aspect of the question. Now paper 2 section A, question 1. A 6-month-old infant attending pediatrics OPD is found to have cyanosis, clubbing and no hepatomegaly. That means no hepatomegaly means no CCF. No CCF means tetralogy of Fallot. Because there are some conditions which present with congestive cardiac failure in cyanosis, some conditions which do not present. If there is CCF, you have to exclude TOF as diagnosis, right? So whatever it is, if there is a cyanotic congenital heart disease, they are only asking about tetralogy of Fallot for the last 10-11 years. So don't worry about your diagnosis. What is the most likely cardiovascular condition? What are the findings in tetralogy of Fallot? What are the hemodynamic changes you see? What is the clinical course and complications related to this condition? We have a video, we have it in the notes, we have covered it in the test series. TOF, tetralogy of Fallot, was come in 96, 2009, 2010, 2013, 2017, 2018, and even 2019, 2020, and now 2021. Cyanotic congenital heart diseases. Please, there are students who are reading ASD, VSD, PDA. These are not in the syllabus. They are clearly given cyanotic congenital heart disease. Now you have to understand what is the classification, what is the approach for cyanotic congenital heart disease, and where do you see CCF, where there is no CCF, and what are all the conditions apart from TOF. We have tricuspid atresia, we have pulmonary stenosis with VSD. Whatever it is there, the only question comes from tetralogy of Fallot, which is the most common cyanotic congenital heart disease worldwide. So if you are thorough with TOF and management of a cyanotic spell or tetralogy of Fallot, okay, cyanotic spell is very important, management of cyanotic spell. So it's a predictable topic again from pediatrics. Now question 1E, adolescent girl wearing artificial jewelry. Come on again, dermatitis can come from soap usage, it can come from bindi, which was asked in the recent grand test, bindi or leukoderma, maybe a potential question, or kumkum, maybe a potential question. It come in the next year, maybe hair dye, okay, or wearing a metallic watch, okay. What are irritant contact dermatitis, allergic contact dermatitis? What are contact dermatitis is very important. Seborrheic dermatitis is important. Psoriatic dermatitis, it's not there, but again dermatitis, eczema is very important. Now even in 2019 also they asked about henna, same question, what is the gold standard diagnosis, what are the constituents or chemicals in henna which will cause this, and how will you treat it. So this dermatological conditions commonly seen in India due to the regular usage of these elements is very important. So dermatitis or allergic contact dermatitis or allergic irritant dermatitis was discussed in detail along with clinical scenarios in our classes. So here they are asking you artificial jewelry presented with itchy papillovascular skin lesions on ears, wrist and neck. Diagnosis, gold standard. How do you interpret these tests? State the complications of this, the test which you perform, that is the skin test. Next question. So we are done with question number 1. One question from derma, predictable one. The other two questions very important from pediatric, cyanotic and all. And from medicine aspect, psychiatry has come, and also the medical imaging part. So the question number 1 is a must. So instead of asking a direct question from general medicine, they are also stressing that you need to, because you might ignore medical imaging and psychiatry thinking that only 5 marks or 10 marks will come, but they made it mandatory by giving it in question number 1, which is a mandatory question. So please never ever ignore anything within the prescribed syllabus, because though it is not important, if it comes in question number 1 and or 5, it becomes the most important in this world. Now question number 1 is predictable. Question number, let's go to question number 2, paper 2, section A. Now we have slowly the general medicine questions has come. 60-year-old diabetic, emergency department, acute onset, central squeezing type of chest pain. Risk factor is diabetes and age, that is 60 year. Type of pain is chest pain, which is central and squeezing, acute pain, severe in intensity, and not relieving even after taking rest. So if it relieves after taking rest, you might think of angina, which might come back again. But again, don't worry about whether it's angina or unstable angina, whatever. You start with thinking that it's a coronary artery disease, then we evaluate, right? Here our most probable diagnosis may be unstable angina or MI, which includes both NSTEMI, non-STEMI or STEMI. How do you differentiate this? How do you investigate this? Based on ECG findings, if it is ST segment elevation or non-ST segment elevation, and also cardiac bioenzyme markers. If they are elevated, it gets into MI part. If they are normal, it gets into unstable angina. Now this is how you investigate. And what are the steps you do? If it is an unstable angina, you will not be doing, or if it is a non-STEMI, you will not be doing reperfusion therapy, but if it is a STEMI, you will be doing reperfusion therapy. And there's a lot of confusions like how to go ahead. I'm giving you so many options of unstable angina, STEMI and non-STEMI, but if I am working in a clinical setup, if a patient diabetic with this kind of symptoms presents, 99% times it is STEMI only. We might need to end up doing PCA stenting, which is referred. So I'm very happy if you just present it like MI, and nothing is given, go for STEMI. I told you already in test series video discussion and also in our classes. Nothing is given in the question, go for STEMI. Okay, manage it like ST segment elevation, because that is the most severest form. You are not missing out on life-saving reperfusion therapy unless and until nothing is given. Okay, so because diagnosis is always based on investigations. By the time you find out that if it is unstable angina or NSTEMI or STEMI, the only basic difference is medical management is same, but only reperfusion therapy point of view is added in STEMI because it's life-saving again. MI, coronary artery disease, ischemic heart disease. From path to medicine to pharma, we have so many topics in common, like vertically integrated ones. Now, clinical features, investigations and management of acute MI, symptoms and signs of MI, management. So when I say management, very important one is follow-up advice. Follow-up advice, that is preventive measures. If you are not going to educate a patient, at least if you're not going to do in your clinical practice, if you're not writing it in the answer, they're not going to give you good marks, because prevention is better than cure. So management should always include counseling or discharge advice or follow-up advice or preventive measures or vaccination. They should be there in your answer when I ask about management. Please never miss out on those aspects. Okay. Now describe the clinical features, investigations and management of acute MI. Describe the symptoms and signs of acute MI. How will you investigate this case and what positive findings you'll get in reports? Describe the treatment. What are the coronary risk factors? What is the management? Same question, unstable, how do you manage? And Gabra heart, sudden breathlessness, perspirations, how will you diagnose it? So there are like common questions like MI, pulmonary embolism. These two are very important topics. Even in 2020 also, discuss the management of acute MI. Straight cut question. Now paper 2 section A question 2. Before getting into the next part, we were focusing on acute coronary syndrome, right? ACS. Most of the times we are discussing the ACS part, coronary disease. But of late in 2020 recently, in the ischemic heart disease, see, syllabus they gave ischemic heart disease. Ischemic heart disease includes both acute and chronic ones. So there is a new condition called chronic coronary syndrome. We all know acute coronary syndrome, but what is chronic coronary syndrome? what are the subtypes associated with it, and how do you manage a stable angina case can be a potential question in the future. So I included in the live GT discussion, live grand test which we conducted recently. Chronic coronary syndrome may be a future manifestation, right? Future question, expected question in the upcoming exam. So acute coronary syndrome, there's so many questions. So if an examiner want to frame a new question in 2020-2021, European Association, Heart Association has given this, framed this new term called chronic coronary syndrome. So the literature is given in the grand test model answer sheet. Yes. Now question number 2B. 12-month-old infant delayed initiation of complementary feeding. The complementary feeding should start at 6 months, right? Till 6 months we do exclusive breastfeeding, and from there on we have to give complementary feeding. And few diarrheal episodes was found to have length, weight of 5 kg, MUAC of 10 centimeter, and loss of subcutaneous fat. Everything is falling in the line of protein energy malnutrition. Now if MUAC is less than 11.5, okay, from 6 months to 5 years age old kid, if it is less, and also there are 2 more criteria to classify WHO classification of protein energy malnutrition, then you end up classifying loss of subcutaneous fat is the one aspect. You have to classify protein energy malnutrition. See, the answer part I'll discuss it in the videos because it's going to take a lot of time. But what is more important is protein energy malnutrition, the severity, classification and management are very important from WHO point of view. In 2019, 15, 2018, they asked the same question. Okay. Now question number 2C1, scabies. See, scabies, what I noticed in derma is, though the question is same, they're jumbling here and there. For example, last but 1 year they're asking about the severity scale, that is the Sorten scale part of a disease, right? Similarly, this exam, instead of asking typical presentation, they're asking you atypical presentation of scabies. They're asking you specific management wise also. They're either giving you pharma or non-pharmacological, or in a 2-year-old child or less than 2, or in a pregnant female how you manage, or in an immunocompromised how you're going to manage. So you have to be specific when you're reading dermatology, and state the causes which can lead to persistent history following. So post-scabitic itch is a condition, and they're asking about that. Similarly, scabies, as I told you, 2017, the similar question has come, and scabies has high potential to get repeated in the future. Okay. Question number 3A. So we're done with question number 2. Scabies is predictable. Protein energy malnutrition is predictable. MI is predictable. Dermatitis, allergic dermatitis is predictable. I think question number 2, I think many would have attempted it if you are serious aspirant, because all these are predictable topics. Question number 3, bedridden for last 2 months, fracture in the lower limb, sudden SOB. So start giving DDF sudden SOB. I think most probable diagnosis is pulmonary embolism, because bedridden condition is a hypercoagulable state. Risk factor is present. Deep vein thrombosis might have developed pulmonary embolism. The investigation part, we did do a clear, detailed discussion on pulmonary embolism. How do you investigate and all, and how do you manage and all is very important. So this is a clear-cut question. 2013 and 2016, similar case scenarios. Bedridden for 3 weeks brought to casualty, fractured hip, bedridden brought to casualty, sudden breathlessness. How do you manage embolism? Similarly, in 2018, femoral neck fracture, bedridden and presented to. All these are fat embolism. Fracture neck will lead to fat embolism, leading to pulmonary embolism. All these are an indirect risk factors for development of pulmonary embolism, which is very important topic again, predictable topic. Now, question number 3B, a term neonate, O negative blood group mother, deep jaundice. So neonatal jaundice. Palms and soles are involved, excessive crying is there, convulsions are noted at 20 hours of life. Convulsions means kernicterus. In the syllabus, they clearly gave you kernicterus. There is always confusion in the group discussion also. Neonatal jaundice is not there in the syllabus. What is there in the syllabus is kernicterus. But kernicterus is a serious manifestation of neonatal jaundice. That is bilirubin encephalopathy, okay, or kernicterus. When the bilirubin levels are so high in the body, they cross blood-brain barrier, they lead to like central nervous effects. That is kernicterus. So kernicterus is nothing but neonatal jaundice. That's the reason even in the last year also in 2019 and 2020 they asked about what are the indications of exchange transfusion, how it is done, right? In 2019 also they asked a question. But per se kernicterus, now how do you assess clinical severity of jaundice in this? By Kramer's dermal zones, and also you have to look for other manifestations. What investigations do you do? Transcutaneous bilirubinometry or serum bilirubin assessment, and also hepatic, because central nervous system involvement, convulsions are there. You also need to focus on diagnosis of the convulsions. And how do you manage kernicterus and all? You have to be very careful. But keywords here are jaundice involving palms and soles, very severe, and convulsions. Your most probable diagnosis is bilirubin encephalopathy or kernicterus. So similar questions to Rh negative mother. Why this O negative negative is very important? Because this severe comes only with Rh negative pregnancy or some risk factors. In a normal physiological jaundice, it's very rare to see kernicterus, and unless and until there is a risk factor. Okay, so it's very important to focus in such lines. Even in 2016, what is bilirubin encephalopathy? What are the factors which contribute to it? What are the pathological and clinical sequelae and all? So kernicterus is discussed in detail in our pediatrics videos. Now, lichen planus, 2020, same question. They give you violet polygonal flat topped papules. Now they're directly asking you what are the clinical findings of lichen planus. At different sites, what findings you see. We have given a table of different sites in our notes. Histopathological findings, okay, which was clearly given again. And you have to histopathological finding, HPE image. Please draw HPE images. Very important. Whenever there is a pathology, there should be a pathological image, histopathology image. And what is the management of oral lichen planus? How to manage it? Similarly, lichen planus 13, 17 and 20. So as I told you, there are some dictum topics from dermatology, and they're like kind of repeated every time. Now cirrhosis of liver is like, if you are a final year student just passed out, or if you are an intern, I think cirrhosis is very important because we do present clinical cases, a lot of clinical cases of cirrhosis of liver with ascites and all. So etiology, diagnosis, treatment, and it can't be more straightforward than this. Okay, cirrhosis of liver starting from 94, there's so many questions, even in 2019 also. What are the common complications of cirrhosis of liver? Management of a case of alcoholic liver cirrhosis. What is the etiology of hepatic cirrhosis? What is cirrhosis of liver? Chronic conditions. Like you're lucky if you're giving exam in 2021. Like the straightforward questions. Now, question number 4b, 15-month-old child brought by mother with history of 6 episodes of vomiting and 4 episodes of watery diarrhea, found to have lethargy and is unable to drink. Vomitings plus diarrhea. So you have to classify based on IM and CI. Okay, severity assessment. What is the fluid management which you give if it is very severe, and what is the treatment management after 3 years. But one very important tricky part is the 8-mark question on composition and WHO. So if you're freshly passed out student, if you're giving your practicals and all, WHO ORS packet is a specimen. It's very important during our practical vivas, right? They'll ask you the composition and all. But again, when you're not recently passed, time has elapsed, like this is purely memory based one. Preparation, you might know, like empty it into the 1 liter, heat it, use it within 24 hours and all. Make sure to give it in a clean utensils and all. 5 marks part can be, 4 marks part can be written even by us. But unless and until you revise or memorize the composition, then it becomes very difficult. And you have to give latest low osmolar or WHO or us, okay, composition. Not the old one, you have to give the latest one here. And diarrheal episode or management of the diarrhea as per IMNCA, you have to classify whether it's mild, no dehydration or severe dehydration, and based on that plan A or plan B or plan C, you have to identify that and you have to treat this patient. Similar questions in 2013 and 2018. The only difference here is the composition of the ORS, which you might not like memorize before the exam, because I am telling you now, I am not a fan of by hiding the things, but again, if you want to add it to the list of last minute revision pearls, just put it there. Now question number 4C1, what is the differential diagnosis of psoriatic arthritis? How would you distinguish psoriatic arthritis from the other conditions? Management of psoriatic arthritis. See, clinical patterns of joint involvement in psoriatic arthritis is very recent question. Now here again, psoriasis is dermatology topic. Man, they nailed it. Derma is everywhere in the paper, man. Okay, so Not only this year, from the last 5-6 years, I had seen many clinical questions coming from dermatology. That's 6 topics. Okay, so the psoriasis is okay, but they have asked about psoriatic arthritis, an extension of psoriasis topic. DDF psoriatic arthritis, we know you have to differentiate from rheumatic arthritis. You have to differentiate it from osteoarthritis. Okay, your rheumatoid arthritis, osteoarthritis are closest differential diagnosis for psoriatic arthritis. If you want to differentiate, you can also do it for reactive arthritis, which comes with gonorrhea. Okay, but again, for me, rheumatoid and osteoarthritis differentiation is more fruitful. Now, if you are preparing actively for PG prep and all, this question is a cakewalk, because there's so many questions on involvement. In osteoarthritis, distal are involved, or proximal joints are involved, or symmetrical or asymmetrical are involved, rest pain or pain after activity. So all this kind of table is there, which I'll give with the notes. That is one part of the discussion. Management is, we already discussed in our classes, right? What are the different types of psoriatic arthritis, clinical patterns, and management. So done. Actually, this should be paper 2 section B. Okay, I think it got repeated here. Section B includes general surgery, OBG plus family planning. Okay, general surgery includes ortho. Why I am writing this, I'll tell you. I keep on telling students that they haven't asked any questions from ortho from long back, except one question from principles of management of the spinal fracture, and other question from Colles fracture. Both are covered in the test series part. Okay, if you are because your preparation is incomplete unless you finish test series with us, because many rare things and like expected things are covered in test series. Basic things, most common things are covered in the video course, very important one. So test series is vital, and we did cover Colles fracture in detail in the test series part. Now ortho has kind of made reappearance again. So now there are 3 topics in ortho, that is bone tumors, spine fractures, fractures of spine, and other topic is Colles fracture, and one more thing is acute osteomyelitis. But actually acute osteomyelitis was not mentioned in the ortho, it is mentioned in the pathology point. Okay, so we did discuss that in class. I gave you notes, I gave you a video, and the same question was asked in the test, subject to test again. It's there in the pathology, acute osteomyelitis and chronic osteomyelitis, but I think you also need to have some ortho aspects to it, acute osteomyelitis. So these are the only 4 topics from ortho. Maybe next year they might repeat a question either from spine or bone tumor. Okay, so this is section B question 5 includes general surgery, ortho, OBG, and very importantly PSM point. Okay, preventive and social medicine. Now this choledochal cyst, we have disorders of gallbladder and bile duct. There are so many disorders like choledochal cyst, cholecystitis, etc. We did cover cholecystitis and gallstone, but we missed out on choledochal cyst, thinking that it may not come. But now all the disorders of gallbladder, see, general surgery per se, the syllabus is huge, like in comparison. There's so many topics, almost 25 to 30 topics. So kind of somehow we missed it, though it's a repeat, because short notes on choledochal cyst types and management was asked in 2003. Okay, so what are the clinical features, diagnostic work and management of a choledochal cyst was asked, like it's there in 5A. Okay, if it's a rare thing for you, it's a rare thing for everyone. Don't worry about this. Okay. Now, paper 2 section A question 5. We have 5B. A 60-year-old lady presented to casualty after a fall on her outstretched hand. Colles fracture, 2016. Okay, so ortho. Section A question 5. FGR, common causes of FGR, strategy for managing a severely growth restricted pregnancy at 26 weeks of pregnancy, and this female has no living issues and a past history of undergoing cesarean section at 32 weeks of history. So similarly, it's a high risk pregnancy. How will you diagnose and manage multigradia with IUGR is in the syllabus. IUGR, or now we call it as fetal growth restriction, intrauterine growth restriction. It's there in the syllabus. That too in the obstetrics part. There are 2 things. One is neonatal resuscitation or immediate resuscitation of a newborn, and other is IUGR. They are there in the syllabus. Management of an IUGR child post birth is discussed and given in the notes, but how do you manage a fetal growth restriction during pregnancy was not discussed, and now it is very important. Causes you can give it very important, placental insufficiency. All the disorders of the pregnancy, they lead to fetal growth restriction. So listing out the common causes and defining fetal growth restriction, we have small for gestational age child, or we have intrauterine growth restriction, okay, or preterm birth. Their definitions are already given in the notes and also in the test series. But what we missed out is how do you manage a a fetal growth restriction when it occurred at 26 weeks of gestation. Okay, I can give the answer, but I haven't discussed it in the class. Okay, we'll be doing it in the discussion videos of this test. So menopause, HRT is clearly there. It's there in the notes itself. Okay, what is menopause? What are the signs and symptoms? What is hot flush? What is BMD? What is osteoporosis? Like how do you control or prevent it? So menopause, postmenopausal syndrome management, osteoporosis, and what is hormonal replacement therapy, and what are the indications and contraindications for hormonal replacement therapy is there. Now question 5, dengue, a major health problem, 2018. It's covered in the test series also. Epidemiological factors, and epidemiological factors was given in the most recent handout, maybe 1 week before the exam. Okay, what are the epidemiological factors which are led? So the temperature change, extensive incubation period of mosquito is coming down. So that's the reason, because of the global warming, this dehydration, mosquitoes are feeding a lot, and also incubation period has come down. That's the reason there is the rampant spread. So environment related spread of dengue is important, and we know how common the dengue is, mainly in the Delhi, okay, in the season, right? And even many of the hospitals, even where I practice, right, dengue season is a kind of a hectic season for physicians. Okay, they're asking you that what are the reasons which have. So epidemiology, kind of, this question is from National Vector-Borne Disease Control Program, which includes management of the arboviral diseases, or diseases which are transmitted by these vectors, arthropod-borne vectors. In that we have malaria, we have filariasis, and we also have this dengue. And within this dengue, they're asking this question. Now paper 2 section A, question 6. So question 5 is done. So this can be done. This can be answered. This is easy again. Some aspects of this can be answered. So this is, we did cover in the test series. If you are writing test series, you will be like up to it. So we missed this important question, that is choledochal cyst. So overall 80 to 90% of the question can be done. Why I am stressing upon this is mandatory question. If they want to twist it, they only twist it in the mandatory question, just to filter out an aspirants who are not serious about this exam. That's it. Otherwise, question number 6, straightforward question from 2020. The same question got repeated here. Reasons for rising cesarean section rate. What are the advantages and disadvantages of vaginal birth? What measures can be adopted to reduce cesarean section rate? How do you counsel a patient who had previous cesarean section for vaginal delivery, that is VBAC? Okay, VBAC topic is also discussed in detail with us. Now paper 2 section A, question 6B. 55-year-old male tobacco chewer presents to OPD with difficulty in opening mouth for 1 month. Tobacco chewer, difficulty in opening mouth, 55 years, risk of CA oris or CA tongue, right? On examination, poor oral hygiene, white patch is noted. So what is leukoplakia and its significance? What are the pre-malignant conditions for oral cavity cancer? And what are the different cervical lymph nodes which can get involved in a patient with oral cavity cancer? So the metastatic spread of oral cancer was discussed in detail. So it's a synchronous or metachronous malignancy, the aerodigestive tract. What are the lymph node stations which get involved? And while treatment, what are the lymph node stations which we do? So oral cavity, see, the same oral cavity has come again in pathology, they asked it, and even in kind of surgery they're asking it. Okay, it's a vertical integration again. Now question number 6C1, when is a protein said to be biologically complete? How do vegetable proteins compare and compete with animal proteins? What are the proteins needed? So most general from nutrition aspect of PSM. So though it's not a repeat, we usually have this human milk versus animal milk question all the time, which is asked. Okay, in the recent past, human milk. Milk is also a protein, but milk specifically contains a lot more than protein. But they went now into some basic stuff. Now they are already asking what is a protein, what is a biologically complete protein, what are vegetable proteins, what are animal proteins, what are the. So nutrition aspect of PSM was asked here, which is not a repeat. One of the rare question again, which is not a repeat. Now paper 2 section A, question 7. A 60-year-old male presents with progressively increasing jaundice for 2 months. Okay, we come to question number 7 now. Question number 6, like except for 6C, rest all questions CA oris is discussed. Caesarean is a straightforward repeat question, right? So 6C1 done. So question number 7A, a 60-year-old male presents with progressively increasing jaundice for 2 months. Clay colored stool, jaundice, clay colored stool, pruritus. So I am talking about obstructive jaundice. Simple. Obstructive jaundice with palpable gallbladder, Corvisarla, it is CA, pancreas, which was very discussed in detail in the video along with the management. So what is Corvisarla? It's a repeat from 2009 again. Even in 1995 also, long back, they asked what is this Corvisarla. Now it has come up again. How will you investigate a patient with CA pancreas? What is Corvisarla? What are its exceptions? And what are the treatment options which are available for this patient? So Whipple's procedure, you have to draw the diagram here. Okay. There are some latest techniques available too. So it is CA pancreas. Okay. 7B, this is latest question again from the latest health programs. So again, it's not easy to cover each and every health program, but if you are reading your Indo article on a daily basis, whatever happens with national health programs, you might be aware of it. This is very interesting topic, mother and child tracking system. It's a new initiative, not new actually, it started in 2019, but question has come now. Briefly explain what is MCTS. But actually it started in 2014 somewhere in few states, but in 2019 it has become nationalized, like maternal child tracking system. All the health related programs of mother and child are tracked from kind of birth to 5 years, okay, in a kid, okay, from pregnancy to 5 years I could say. They're asking you to explain this MCTS, what are its objectives and how it is being put into operation. So the third or fourth question, which is not a repeat here, MCTS. We did discuss Janani Suraksha Yojana, JSSY, RSBY, Ayushman Bharat. All the latest health programs are important, and they all come under not national health programs per se. They all come under RCH. Okay, reproductive child, like the child and mother related stuff, or NHM, National Health Mission. That too, National Rural Health Mission, which is there in the syllabus, NRHM. Now, question number 7C1. How will you investigate a couple, 35-year-old wife, 37-year-old husband, wife 35 means we have to investigate, like it's getting late, married for 3 years, but trying for conception only since 6 months. What are the major factors which affect fertility? Treatment for unexplained infertility. Unexplained infertility we did discuss, but how to go ahead with fertility? With infertility, I'll be adding up the detailed discussion on infertility with this 2021 paper discussion. Okay. Similarly, infertility is not a uncommon topic. Definitely, it's very important. Starting from 1997, even the latest 2019, our friend again 2019. There's so many questions from fertility. Okay. Now, finally, question number 7 is done. This can be answered if you know the previous ones. We did discuss unexplained infertility, but 10 marks we did miss it. And MCTS is the latest one, which is like not a repeat. We did discuss this in detail. So these are the 3 questions which have come from this. Now question number 8A1, summarize spectrum of IDD. IDD we did discuss in 2019, it got repeated, and IDD control program also we did discuss, but look at the weightage, 20 marks. Now next is MTP Act. So there are 3 or 4 acts which are very important. PCPNDT Act, okay, MTP Act 2021 amendment, okay, which was discussed, which was updated, and you have been given a handout. And latest we have family planning bill, the latest one, family planning and surrogacy bill. Surrogacy bill, in family planning we have surrogacy bill 2021 and may be expected in the next year. And we also have ART, assistive reproductive ART bill 2021. Be aware of this. So the handouts have been already given on these topics to the enrolled students, may be expected in the future. Last year they asked this bill, DNA bill, DNA fingerprinting bill in 2021. So any bill or act or amendment which is related to the syllabus, I am covering it whenever it is released. So like you have one act or bill is expected mandate for last 3-4 years. Okay. So provisions and scope of MTP Act was asked in long in 2004, but there is an amendment in the recent past. They have transformed into 24 to 28 weeks and all. there are other key highlights of the act which were discussed again. Okay, what are the major changes that have been introduced under MTP Act is one question, and what are the different contraceptive methods in India, their order of usage, what measures can help increase the use of contraceptives. I think you are better person to answer these social kind of questions, right? Because you are a UPSC aspirant. This is a key area. They might ask you this even during interview stage also. Okay, what measures can help increase the use of contraceptives in India? Now, paper 2, section A, question 8. Last question is 8C, right? 8C, tumors of thyroid and adrenal gland is there in the syllabus. Tumors of thyroid and adrenal gland. And when I say thyroid, you have to know the DD of thyroid swelling, that is solitary nodule of the thyroid. How do you investigate? And mainly, what is follicular neoplasm and how do you manage papillary neoplasm? So, papillary versus follicular or anaplastic are the three variants which we have. So, similarly to 1999, 2006, 2016, similar questions have come in this regard about the carcinoma or thyroid tumors or tumors of the thyroid. So, I think this will conclude our discussion on 2021 medical science optional paper. So, in this, I think almost 2 hours of discussion. What are your take homes? Your take home is overall the paper, many like almost 70% of the aspirants whom I interacted with, they said that it's an easy paper. They're very happy with it, and many have said that almost 85 to 90% we have covered it in the notes. Okay. And the remaining 5% can be indirectly interpreted from the notes. And there's only one question I'll not call it as out of syllabus again, because if I start propagating this agenda, people will be confused like there are questions from out of syllabus. But don't know, somehow in the thorax they're asking this intercostal space. Every year one out of syllabus question is coming from anatomy. I don't know why. Like arches of foot has come once, suddenly, arches of foot. Nobody will be, even for our exams also, final exams, board exams, we won't be preparing that arches of foot question, right? So there is an outlier or bouncer, but again, don't go for out of syllabus stuff. And as I already told you, no question on COVID so far. Like even in this 3 years of the pandemic of the COVID, there's no question on the coronavirus. And repeats part, only 4 questions are not repeats. When I say only 4, almost it is 2% of the whole paper, right? 2 or 3% of the whole paper. Almost 97% or 95 to 97% are repeats. What are not repeats? The protein question, intercostal space question, MCTS question and hepatic segments are not asked so far. And look at the repeat ratio. Starting from 2016, okay, 2017, 2018. So I'm only taking last 5 years of papers. So in 2020, the most latest, we have almost 14 questions. I'm just taking it in a written order. 9 questions has come from 2020. In 2019, 22 questions have come. In 2018, 14 questions. In 2017, 10 questions. And in 2016, 14 questions. That like either direct or indirect repeats. Look at the ratio. Okay. Look at the ratio. On an average, we have 16 questions, right? 8 from first and 8. In each question, on average, we have 3 to 5 subsets. 3 to 5 subsets. So, if you take it in that ratio, if you take the maximum one, like almost out of 80 questions, more or less, many of the questions are direct repeats only from last 5 years. So, when you are preparing for medical science as an optional, okay, if you are targeting 2022, so please, your take home should be only prepare common things. Don't worry about the uncommon things. And everything is within the syllabus. So prepare in a syllabus specific manner, that to focus guide centric fashion. Focus guide by a UPSC MEDICO. Like you should have it if you're preparing for medical science optional, because it covers all the previous year questions along with the topics mentioned. Okay, in a more segregated or integrated manner. Now, next 4th thing is last 5 years are at least must if you want to give a grade. And 5th and foremost is test series. Even though question looks familiar to you, like even though it's a repeat, even though I have discussed it in the class or I have given you a notes, unless and until you write it for given weightage for 10 marks or 20 marks, even the brightest of the students this year, they face difficulty in content recollection or content presentation. Recollection is the memorization or presentation. So recollection or memorization comes with multiple revisions, but content presentation for because you might feel content lag or content deficiency. Okay, content deficiency. This can be corrected with test series. So unless and until you do multiple revisions of medical science optional, unless and until you finish off your test series, you're not gonna rock this exam. Okay, if you want to get into the more than 300 zone, if you want to get into top 100 in the UPSC ranking system, you have to at least do 2 to 3 revisions of the medical science optional notes and write major part of the test series just to cover up that content deficiency. So how to build content? You may be aware of 5-mark part, but you might need to present it in a 10-mark fashion. Then answer writing practice will give you that extra edge, like how to integrate in a given time period. So it also gives you time management skills. So in the description, like in the description below, I'll be giving a link to download new focus guide. I'll also give you a link to enroll into the multiple course options. We have a combo course which is live for 2020-23, and I recommend this to all the new aspirants because it not only includes video course, okay, it also includes notes, PDF, the most latest one. It also includes 2020 paper discussion videos. It also includes test series, which is vital. Okay, test series includes test series discussion, question and answer format videos. It also includes model answer sheets. It also includes topper copies, top 3. It also includes all India ranker copies. So once 2021 results are out, they will also be uploaded here. Okay, so it's a holistic approach to your upcoming exam. Not only that, if you have already enrolled into one of the course and it got expired, if you only want 2021 paper discussion videos, that is notes plus videos of all these questions, you can enroll into a separate course, which I'll be adding the link in the description. Now I think at the end of this session, you might be aware of the fact that previous year question paper analysis is very important, because examiner will also do that. He'll take care of 4 or 5 papers, and whatever topics are there, he'll try to repeat the questions either in a direct fashion or in an indirect fashion or in an updated fashion. That's it, or with tricky words just to confuse you. But at the end of the day, topics are same. Common things are first, uncommon things are next. Common things are first. Revise and revise. Only read that much which you can revise in the last part. Don't thrive for sense of completion. Many students will do that and they'll start asking me for more content. More content is not going to help you. Whatever content is there, try to revise it multiple times. That's going to help you. Okay. So all the best for the upcoming year. Take care. Yeah.